Have you ever waited hours in a hospital watching your loved one suffer, just hoping a doctor will finally come? For many Malaysians, long delays in treatment have become normal, not because doctors don't care, but because there simply aren't enough of them. Some doctors have already collapsed from exhaustion. Others have left the country in search of future they were denied here at home. This isn't fiction. It's the painful reality unfolding in our hospitals right now. To tackle this growing crisis, the government must take immediate and decisive action before the situation worsens beyond repair. Assalamualaikum and good morning to the members of the audience. My name is SITI MAIMUNAH binti HALIL and I stand before you today as a concerned Malaysian and a passionate advocate for healthcare reform. The title of my speech is going to be "The Government Should Enforce Policies to Support the Healthcare Workforce." This matters to all of you here because as policymakers, your decisions shape the healthcare system that every citizen, including you and your families, depend on in times of need. Whether Malaysians tomorrow will have access to safe, reliable care depends on what you choose to do today. I have spent time researching the stories of healthcare workers, reviewing critical data, and witnessing firsthand the immense pressure our system is under. I stand before you not just as a speaker with facts, but as someone with a genuine understanding of the struggles faced by those who care for us when we are most vulnerable. Ladies and gentlemen, the Malaysian government should enforce strong, immediate policies to protect, support and retain our healthcare workforce because without decisive action, the nation's healthcare system will continue to deteriorate, putting countless lives at risk and threatening the well-being of every Malaysian citizen. Today, I will explain the serious problems our healthcare workers are facing, propose clear solutions, and show how these changes will strengthen the healthcare system for everyone. Firstly, let's take a hard look at the crisis threatening the very core of Malaysia's healthcare system. Malaysia's healthcare system is on the brink of collapse because of three urgent issues. First, a worsening shortage of medical professionals. Second, escalating violence against healthcare workers. And third, systemic injustice in the treatment of contract doctors. According to the article, Malaysian Healthcare System, a Collapse in Denial by Code Blue 2025, Malaysia is facing a massive brain drain, losing over 5,000 doctors and nurses to countries like Singapore and the Middle East. This forces the remaining staff into exhausting, burning-inducing shifts that put both patient safety and doctor well-being at risk. On top of this, violence is a daily threat. A study in the Journal of Health Research by Sahiran et al. 2021 revealed that 38% of healthcare workers in Malaysia's emergency departments have experienced violence, often from the very patients or families they are trying to help. And if that weren't enough, contract doctors, who make up a large portion of our workforce, are paid less, denied essential benefits, and blocked from career advancement compared to their permanent colleagues, as highlighted by Go 2021 in Hartal Doctor Contract and the Government Contract Worker issue. Distinguished guests, these are not just numbers. These are real people, real doctors, real nurses, and real patients caught in a crumbling system. These problems are not unsolvable, but they demand immediate action. Let's turn to the solution that can rescue our healthcare system before it's too late. First and foremost, as government, you need to take the lead in building strong public-private partnerships, as Abasilim and Oboseka 2024 explained in Transformative Strategies to Combat Brain Drain and Retain Public Health Personnel. The key to stopping brain drain is creating high-quality jobs and innovation ecosystems that encourage professionals to stay. This means engaging seasoned private sector mentors, offering growth of opportunities and making Malaysia a place where healthcare workers want to build their futures. Second, you must implement comprehensive anti-violence measures to protect our healthcare workers and ensure hospitals remain safe spaces for both staff and patients by coordinating with law enforcement, improving hospital security, training staff in de-escalation, and providing mental health support. The attacks on healthcare workers can be significantly reduced. The UK's NHS Protect program, as reported by the Department of Health and Social Care 2018, is a proof that these strategies work. Third, the government must ensure fair treatment of contract doctors. As Norehan Zinah et al. 2023 emphasized in Contract Doctors Strike in Malaysia, a context analysis of the perception of medical fraternity and stakeholders on Facebook, the government should absorb contract doctors into permanent positions based on merit using fair interviews and transparent criteria, not just reward time served, while ensuring they receive equal pay, benefits, and career opportunities. Honorable attendees, now let's imagine the transformative impact these reforms will have on our healthcare system and our society. By building strong public-private partnerships, we can retain top talent, create local opportunities, and guarantee that every citizen, no matter where they live, has access to timely world-class healthcare, as emphasized by Abbas Ilim and Oboseka 2024. Then, implementing anti-violence strategies will create safer hospitals, protect healthcare workers, and safeguard patient care by reducing distractions, trauma, and staff turnover, as highlighted by Chai et al. 2023. Lastly, ensuring fair treatment for contract doctors will empower them to pursue specialist training without disruption, expand healthcare access in undeserved areas, and strengthen our system to meet the challenges of an aging population and rising patient expectations. As Code Blue 2022 points out, provide permanent positions to all contract doctors. These are not just policies, they are the foundation for a brighter, healthier future for Malaysia. Respected members of the floor, these reforms offer more than just solutions. They offer hope for a stronger, fairer, and more resilient healthcare system. In conclusion, we have looked at the serious crisis gripping our healthcare system, explored practical solutions like public-private partnerships, anti-violence strategies, and fair treatment of contract doctors, and envisioned the powerful benefits these reforms could bring to Malaysian society. Policymakers, the future of our healthcare system rests in your hands. It's time to turn policy into protection, inaction into investment, and short-term fixes into long-term transformation. Enforce policies that support and sustain the people who care for this nation. The future of our healthcare system isn't just about policies or budgets. It's about the lives of every Malaysian. If you fail to act now, we risk losing the very foundation of care that holds our nation together. Let's choose to stand up for those who stand beside us in times of need. The time for action isn't tomorrow. It is today. Because the cost of waiting is a price we can no longer afford. Ladies and gentlemen, thank you all for your time, attention, and for caring about an issue that affects every one of us. Together, we can be the voice for change and the hope for a healthier future.